My name is Bill Kennedy, and I've been a faculty member at the Stanford School of Medicine for the past 15 years. And my clinical practice is entirely based at the Children's Hospital at Stanford, the Packard Children's Hospital, where I have a specialty in genitourinary reconstructive medicine. As part of my role in the course, I was a physician partner, and what that entailed was providing the students with both problems within my specialty that needed some work from the service perspective and patient engagement perspective. Once we identified those problems, then it was going ahead and finding patients within those different areas of interest for the students to meet with and talk with. Once they actually accomplished that, then it was sort of gently guiding them through some of the medical aspects that they needed information on and help with as they came up with their solutions to the problems. Being a part of the course was extremely valuable both to me as a pediatric urologist and also to the Packard Children's Hospital, because it gave us a way to involve people outside of our day-to-day environment in looking at problems and pain points that we have and coming up with innovative solutions. One of the projects was based on urinary incontinence, adolescents who have trouble controlling their ability to hold urine in their bladder. And one of the problem points for them as they move on in the adult world is concealing the fact that they need to pass a catheter into their bladder in order to evacuate the urine and stay continent. And the group of students innovated on a design for a catheter so people could do this in perfect concealment within a public restroom, a college dormitory, a workplace. The second project was actually more in the educational realm. And the group of student entrepreneurs that worked on this project tried to come up with an educational campaign to engage young men and young boys in learning how to recognize testis cancer and be a part of the active screening process. Both of the projects are still actively being worked on. The product for the catheter actually already has a provisional patent. They've actually had some funding granted both through the Children's Hospital and an pediatric surgical innovations group to sponsor prototypes. They're in the prototyping phase right now and also looking at some alternative funding sources. So that one's moving ahead very rapidly. The educational campaign, they've got the whole program for it together, and we're hoping to roll it out during the fall of this academic year. The two teams that I've worked with, I think, truly will impact on the way we practice medicine and the way patients are cared for in the country as a result of the activities in the class.